Hi. So, what is the best blood marker to assess your health? This is a question I got as recently as today morning. So, everybody expects one single answer, one blood test which reveal the whole condition of your health. I'm sorry to say such a blood test doesn't exist. So, your body works in a different way. It's a system. It has got like many smaller systems which packed into one big system. So you can say your nervous system is one aspect, your digestive system is another aspect, your blood sugar control is another, endocrine system is another aspect. So there are multiple systems that work together to form your entire body. So if you think you can assess your whole body or your whole health just by one or two markers, it's not possible. I have to give it you straight. So yes, there are some tests which I think, from my experience, from my understanding, that which I feel is like super important. So most common problem out there is your lack of metabolic health. So what tests are useful to assess or analyze your metabolic health? Number one, fasting insulin. Number two, HbA1c. And number three, lipid profile. So in lipid profile is something which people gets it all wrong all the time. They just look at total cholesterol, LDL, both high. Oh, I'm screwed. I'm gonna get a heart attack. So that's not how it works. So you have to see all of these markers together, all three of these markers at least, and there are other markers too like HSCRP, your ferritin levels, your homocysteine. These are all important markers, but you should see all these markers together. That's when you get the whole picture. In fact, there's another test called PP insulin, which is like the postprandial insulin, which is you can get this insulin test done after 2 hours of meal. I would say that is like probably the more useful test compared to even your fasting insulin. But the reason we don't say it much is because, let's be honest, nobody likes going to get a blood test after food. So this is not something people do. And even if you get the blood test done, what most people do is they have some snack or namesake meal and just get it done. So this is where these results are inaccurate. But if done properly, this is like a very important test, and this will give you like a proper insight. So coming back to my earlier point, so all of these tests speak volumes together, right? When you're seeing just the lipid profile, okay, HDL high, LDL high, doesn't make sense and shouldn't make sense. If somebody is trying to make sense of it, then it's a lost cause. For example, if somebody has a high LDL but he has a normal HbA1c, normal fasting insulin, normal HSCRP, normal homocysteine, he's looking fit, he doesn't have his a proper waist to height ratio, he's totally fit, he's very athletic. Just because the LDL is high, I don't give a shit. The LDL shouldn't matter at all in this case. But as opposed to this, somebody has a higher fasting insulin, somebody has a high HbA1c, somebody has a high HSCRP, somebody has a high homocysteine, then yes, LDL is a problem, high cholesterol is a problem. So that's how you see things. You see things in conjunction. Another factor is you should see at your vitamins and minerals also. If that is very much underrated markers. Those are very important, like vitamin B12, vitamin D, iron. Iron is critical. It has a direct iron. Even B12 and B9, folate have direct influence on your HbA1c. Most people have no clue about this. So these are all things you should keep in mind. Even your normal CBC, the first page you see in most reports, CBC, red blood cells, white blood cells, lymphocytes. So these are like, people take this lightly, right? These are like a few markers here and there. Who gives a shit? But when you actually know stuff, then you realize like, yeah, these are giving me valuable insights, very valuable insights. Like you can figure out whether you have an iron deficiency, whether you have a B12 deficiency, whether you have a B9 deficiency, or you have some other blood malignancy, all from this simple CBC. Obviously, you have to cross check it with the other markers, but it can give you valuable insights. So when it comes to blood tests, you should see everything in conjunction and not as a single isolated test. And what test do I recommend? Again, it depends from person to person. And in general, I'm putting this video out for the general public. I'm assuming you don't have any serious condition. I'm just putting like you are just want to check your health. Say somebody in his 40s. I would go for HbA1c. I would go for fasting insulin. I'd get the fasting glucose. I'd get the CBC. I would definitely go for a liver function test, kidney function test, thyroid panel, vitamin B9, B12, vitamin D, HSCRP. These are all iron panel. So these are all tests I would recommend. From top of my head, I can think of these. And given particular circumstances, there are other tests we can go like homocysteine and testosterone and cortisol. These are all relevant. Just piling on test after test is not going to be. It's just going to, put a hole in your pocket, but there's no much use. So these are all analytic tools, and you should know where to use it. Like homocysteine, I would test it once a year, not more than that. And same with fasting insulin, I would test like if everything is in control, once in 6 months. If something is off, I change my lifestyle, I change my diet, go back after 3 months. That's it. That's simple. Anything more, somebody here listening to this says, yeah, oh, this guy has a tie-up with the lab. I have no tie-up with absolutely anyone. Let's be clear on that. I don't give a shit about what lab you test about. Yeah, there are good ones and there are bad ones, but it's about your budget. It's about your budget. You get it in your budget. Get all like what I would suggest is get a full body test package, and probably you'll miss out on a few tests like B9 or fasting insulin. Probably won't be there. In which case you do it additionally. That would cost you like a 500 to 1,000 rupees extra, but that is a small price to pay. So this is what I have to say. One, see your blood markers not in isolation and in conjunction. Another thing is get your blood test done periodically, even if you are a youngster and if you don't have a health condition, because health condition might not be apparent. But why wait for it? When you can catch it before? So get it periodically, get it from a proper lab. So these are my three tips. I hope this really changes your mind about blood test and not looking at one parameter or another in isolation. That's complete bullshit. Anybody with sense will tell you like one parameter here, one parameter there. Usually doesn't matter. It's the whole picture, and you need a sensible mind to put it all together. You need to get go to a practitioner like us, or you have to go to a doctor and somebody who's willing to spend the time to analyze all this. That person will tell you the exact picture. You analyzing yourself, sure you can, but I wouldn't advise, because it's easy to go from a cold to a cancer when you are Google searching and searching on ChatGPT. So I wouldn't go that far, but it would be best to get it tested and reach out to a practitioner.